So thank you all so much for joining me today for our panel discussion around bridging the gap, how we can adopt a scientific approach to supporting students of determination in schools. And this panel discussion is on behalf of Safa British School, who have asked myself and my team to host this webinar so that we can really look at a question that is over all of our heads at the moment, how we can best support our students of determination, and really pulling on all of that clinical and scientific practices that can support us to do that. Okay, so let me get started by going through our objectives for today. So I will start off with our speaker introductions. I'll go through some very brief bios. Then I'll talk a little bit about why it's important for us to actually bridge the gap. We'll talk about policy and guidelines from the KHDA, and then we will go into our discussion around how we can implement a scientific approach, starting off with ABA, then psychology, and then occupational therapy. And then I'll talk a little bit about at the end about how we can form professional partnerships. Now, there is quite a lot to get through and we don't have a lot of time, so I have asked our professionals to be quite brief and give a general overview, but we will be available for questions, and we'll also leave our email addresses with you at the end if you do have any further questions that you'd like to discuss. Now, my little cartoon, which I find rather amusing, is what we're trying to get away from. We don't want to be hid under the stairs anymore. We want to be out there in common learning environments with the rest of our typically developing peers. And these are just some strategies about how we can do that effectively. Okay. So first of all, I'd love to introduce myself. My name is Teju Sonuga. I am the head of the Bridge Learning Centre. And previous to this role, I was the Director of Inclusion at Safa British School. I've worked as an assistant principal, a SENCO, class teachers across many of the year groups in Dubai and also in the UK. I'm very, very pleased to be partnering with schools across Dubai with the Bridge Learning Centre now. And I'm honoured to have with me some of my fantastic team. So first of all, we're going to hear from my lovely BCBA, Daniela. And Daniela is an experienced and accomplished BCBA. She's worked for over 5 years in the States and in the UAE across different environments. She has a master's in applied behavioural analysis and a bachelor's in neuroscience, and as well as being board certified. So she's definitely an expert on ABA, and she'll be sharing with us some information about the functions of behaviour and how we can apply that to our teaching practice. And then we're going to come on to our clinical supervisor and psychologist, Ms. Anuja. Now, Anuja has, again, she's got a plethora of experience across diverse settings. She herself has been a head of inclusion in schools, so she understands the struggles and worked as a psychologist. She's a certified cognitive brain trainer, and also she has a specialism within counselling and play therapy. Anuja has her master's within psychology and health, and also she has her bachelor's within psychology. Okay, so she's a cognitive brain trainer, like I mentioned, and she's an absolute asset to our team. And I can't wait to hear more about how she can instruct us on using play therapy and social emotional approaches to learning. Our last speaker today is Ms. Rabab. Oh, I don't know if my screen's showing properly. There we go. Ms. Rabab, she's an occupational therapist who works closely with us at the Bridge. Rabab works with the Hope Centre, and she has a master's in occupational therapy, and she's also a certified aquatic therapist. And so she delivers hydrotherapy and occupational therapy sessions at the Bridge Learning Centre. Rabab, again, has lots of experience across the UAE and I believe India. Is that right, Rabab? Yeah, okay. So this is the part of my team I have with me today. Not all of them could join, but I'm very grateful for the ones that we do have. Okay, introductions over. So why do we have to bridge the gap? Now, not only do we all understand the concept of why it's important for us to include students of determination effectively, but the policy guidelines are really, really pushing us to do that effectively. Now, this is just a quote that I've taken from the KHDA 2019 Inclusive Policy Guide. A disability is the result of an individual's interaction with society, and it's not the attribute of a person. Now, what does that actually mean? It means that disabilities are a social construct. So how do we reduce disabilities? we reduce the barriers, we increase the provision, we change our approach. And in doing that, we are actually effectively reducing disability and improving the experience of students of determination. So there are multiple policies and guidelines that I know our heads of inclusions will be very familiar with by now. And I just wanted to draw your attention to where they highlight that it's important that we use professional partnerships in bridging the gap. Now, as you're aware, in 2017, it was made mandatory for us to ensure schools are accepting students of determination and meeting their needs effectively. And schools were encouraged to change and improve their physical and human resources to ensure the provisions and facilities were equipped to do that. Now, what this looks like is the professional partnerships on multiple layers, with early intervention centres for students of determination, with vocational and alternative pathways, and with therapeutic and medical centres. And this is actually where the bridge comes in. We're named the bridge because we want to be that bridge between that mainstream and that clinical therapeutic early intervention setting. And there are many other centres who are doing wonderful work in this field as well. I would just draw your attention as well to the Advocating for Inclusive Education Guide for Parents, which highlights that they can have alternative options when students have needs that are far more complex than a typical entry. And they encourage schools to look at Rahal and and have lots of different initiatives in order to do that. And that is another way that Bridge is able to meet those needs. Okay. To give you a little bit more information on how ABA is used to bridge that gap, I'm going to hand over to our BCBA, Miss Daniela, and she will go through the functions of behaviour and how to manage challenging classroom behaviour. Okay, I'm going to stop my share and hand over to you, Daniela.
Okay, so I'm Daniela, like Teju said, and I am the BCBA for the Bridge. Today I'm going to give you a brief explanation of the functions of behavior and some tips about how you can use this ABA concept in your classrooms. Yeah, so I'll briefly, so my objective is to explain in the ABA way why we do the things we do and explain what the three-term contingency is, as well as have a very brief explanation of reinforcement, and then go into briefly what the four functions of behavior are, and then some tips about how you can apply some ABA concepts in the classroom as well, and then how applying ABA to SEND provision. So firstly, I just want to give you a brief understanding of behavior analysis. So in behavior analysis, we consider everything we do as a behavior. So not just a challenging behavior like crying, screaming, but also talking, writing, eating, reading. So we consider everything that we do a behavior. And then we break behaviors down into three main parts, which is what we call a three-term contingency. So, and this helps us understand why we do the things we do, and then identify the functions of the behavior. So why the behavior is happening. So the three-term contingency is one of the most fundamental concepts in ABA. And a contingency is simply an if-then relationship between the occurrence of a behavior or a response and another event. So we have the behavior, which is, for example, talking or crying or hitting or kicking. And then the antecedent, which is what happens before the behavior. So any environmental changes that happens before the behavior occurs. And then the consequence is what happens after the behavior occurs. So the reaction of someone else or the changes in the environment that occur. So this is what we call the ABC, or the three-term contingency. So it's important to understand that it's just a simple if-then relationship in the contingency between a particular response and a particular consequence. So if a response or a behavior occurs, it's likely that a consequence will occur, and unlikely that if the response or the behavior doesn't occur, it's unlikely that the consequence will occur. So I'll give you some examples of this. So for example, if you raise your hand and then the teacher calls on you, so in this case, the behavior is raising your hand, and then the consequence is the teacher calling on you to answer the question. The response, so it's unlikely for the teacher to call on you if you don't raise your hand, so that's the consequence, and it's more likely for the teacher to call on you if you raise your hand. So you can see that relationship between the behavior and the consequence. Another example could be if you touch a hot stove, then it's more likely that you will feel pain. So the behavior will be touching a hot stove, and the consequence will be feeling the pain. And it's unlikely that if you don't touch a hot stove, you will not feel the pain. Yes, a few other examples that we see every day for when we split it into the ABC 3-term contingency would be, for example, you have an itchy arm and then you scratch it. So the antecedent would be that you feel that your arm is itching. And then the behavior would be you actually scratch your arm, and then the consequence is that the itch goes away. Another example could be you didn't eat all day, now you're feeling hungry and you're driving home and you see a McDonald's sign on the way home. So you and then the behavior will go, you pull into the drive-through and buy some food. So that's the behavior. And then the consequence would be that you get the food and you eat it and you no longer feel hungry. So if you ever had any BCBAs in your classroom, they're probably always asking you, if you have any challenging behaviors in your classroom and the BCBAs there, they're probably asking you to take ABC data. So they want you to see what happens before the behavior, what happens after the behavior, how does the teacher react, how does that other students respond to this challenging behavior. And this is how we make predictions and analysis on why the behavior is happening. So why is it important to understand the 3-term contingency? It tells us what treatments we have available and what we need to do to change the behavior. So we could simply focus on the antecedent, for example. So in this example, we have John's parents leave him alone in his room, and so John throws things and cries. And then the consequence would be parents come in the room, reprimand him for crying, and then have a discussion about how he needs to be a big boy. So we can, create interventions to target the antecedent. So what happens before the behavior? So we could simply, if we change the environment so that John's parents don't leave him alone in the room, then we eliminate the crying and the throwing things, and then there's no need to have the challenging behavior of crying and throwing things. We could also intervene and have intervention focus on just the behavior. So we could teach, John to call for his parents' attentions, or ask for help, or say, please come help me, or please be with me in my room. And then this will function as, instead of crying, he will use this behavior, and then this will eliminate the need for crying and throwing things. And then we can also intervene on the consequence level. So if, for example, John is crying to get their attention, so if the parents stop going into the room when he's crying and rather wait until he's calm and then go into the room, then John eventually will learn that crying doesn't get his parents to come into the room. Rather, instead, he would need to be quiet and calm, and then he will get his parents' attention. So this is a brief explanation of why it is important and why we always use the 3-term contingency to develop our interventions. Another main focus and main concept in ABA is reinforcement. So, this is something we use every day. Everyone uses it every day without us even noticing it. So, consequences affect the likelihood of a behavior happening in the future. So, reinforcement is the same as a consequence, but that strengthens the behavior, increasing the frequency of the behavior in the future. So if a behavior is followed by a reinforcement, then it's likely that that behavior will continue to increase in the future. So some types of reinforcements are tangibles like money or salary, or an activity like playing outside, watching TV, social praise, social attention, some sensory seeking, and edibles like chocolates or a cake or anything like that. And then we have two different types of reinforcement. We have negative and positive reinforcement. So positive reinforcement occurs when a behavior is immediately followed by the presentation of a consequence that increases the future of the behavior in similar conditions. So for example, in this example, Bart Simpson is studying hard for his exam, and then he gets a good grade, and so he gets to play with his PlayStation game, for example. So it's likely that it will increase the likelihood that Bart will continue to study hard for his exam, because if he gets a good grade, then he gets to play with his PlayStation or play on the computer. And then negative reinforcement, it occurs when a response is followed by a removal or a termination of something that is unpleasant or something you don't want to do. And then this also increases the frequency of the behavior happening again in the future. So what's important with reinforcement is that it always increases the likelihood of the behavior happening in the future. So for example, in this example, the house is smelly, the house is smelly and they're trying to get rid of the smell. And then the trash is picked up and taken away, and then the smell is gone. So it's more likely to increase the behaviors of throwing out the trash, because it means that the smell will go away. So that's a very brief explanation of reinforcement and how we use it on our everyday therapy and ABN in our regular lives as well. So now we'll go into the functions of behavior. So all behavior happens for a reason, and knowing what that reason is will help us practitioners to increase intervention and provide behavior intervention plans, and specifically treat one specific, like changing the environment or changing the way people react to a behavior or teaching new skills. So the function means why the behavior is happening and what is reinforcing the behavior and maintaining the behavior occurring in the future. So like I said, anything that's reinforcement means that the behavior, anything that's followed by reinforcement means that the behavior will likely increase in the future. And then we have 4 functions of behavior. We have attention, escape, access to tangible, so any toys, any material things, and then sensory or automatic reinforcement. So I'll just give you a brief explanation of escape and a brief scenario, and then some tips about how you can use it in your classroom. So for escape and avoidance, it's something is or signals an undesirable situation that a person wants to get away from it. So for example, in this scenario, it's an English class, and Kevin has been given a worksheet to complete, and he's not completing his work. Then the teacher approaches him and he throws his pencil. So the teacher sends him to the principal's office, and he doesn't complete the worksheet. So now Kevin has learned every time Kevin has English, he throws his pencil. So now he has learned, okay, if I throw my pencil, I get sent to the principal's office, and then I don't have to complete this boring worksheet. So rather than sending him to the principal's office, I'll give you some tips, some ABA strategies that we usually use to respond to escape behaviors. So enriching the environment, making the environment or the activity that or the demand more fun, more engaging. And then modifying tasks. So break it into parts. Okay, rather than doing the full worksheet, we'll start by doing 3 questions from the worksheet, and then slowly increase it to 5, and then 6, and then eventually getting all the worksheet done. And then making sure that the task level is the same, matches the student level. So we want to make sure that our students are actually able to complete the task, and it's not that they're not escaping because they're not able to complete it and it's too difficult. And then reducing the demand while still maintaining control. So this is another example. Instead of completing the full worksheet, okay, you can do question 1, 2, and 3. So you're reducing the demand, but you're still in control, rather than, okay, you don't have to do it, or you get sent to the principal's office, or completely escaping the demand. And then providing schedule breaks and using visual schedule and token systems. So using like a reward chart, okay, finish 3 questions. When you get all your tokens, then you can go outside to the playground. And then using the first then statements. This is something in ABA, all our therapists, our RBTs are always using first then statements, because that's the relationship. First, you do your work, then you get to the playground. So you have the behavior and then the consequence. And then we always focus on teaching functional communication skills. So for example, teaching to ask for a break, teaching to ask for help, teaching like this worksheet is too difficult, can I have an easier one? So all those functional communication skills. And then another concept we use in ABA is the high probability sequence. So we give 1 to 3 short, easy tasks, followed by a difficult or a non-preferred task. So this will increase the probability that the student will engage in the difficult task after they had already engaged in 3 easy tasks. So it's building behavior momentum. So, I mean, something we use with our students, it's like clap your hands, touch your head, and knock on the table. But in the classroom, you can provide 3 easier worksheets and then followed by a longer, harder worksheet. So now moving to access to tangibles. So this is wanting access to a specific item or activity. So in this scenario, we have Michelle, and she's playing with the iPad, and then Sam also wants to play with the iPad. So Sam pinches Michelle, and Michelle gives Sam the iPad. Sam continues to pick Michelle when she wants the iPad. So now Sam has learned that, oh, if I pinch Michelle, she will give me what I want. She will give me the iPad, and then it might translate to other items. If Michelle is eating chocolate, and then Sam will pinch her, then it's likely Michelle will give it to her. So now Sam has learned this, so we want to teach her other behaviors and other strategies on how she can gain access to that tangible. So some of the things we use is providing schedule access to tangibles. So during break time, say, okay, you can have the iPad during your break time, or you can have the iPad for 30 minutes after you eat your dinner. And then using a timer or countdown when removing toys or ending an activity. So giving students a warning, okay, you have 2 more minutes in the playground, then we're gonna go back inside the classroom, and then setting a timer as well for the 2 minutes to signal that, okay, it's time to give up the tangible. And then again, always teaching functional communication. So teaching to request for the item, like I want to play, I want the iPad please, or teaching to ask for more time, can we have 5 more minutes playing in the playground. Something we also do a lot, especially with our students with autism or ADHD, just teaching waiting skills. So yes, you can have the iPad, but in 5 minutes, or teaching turn taking. So Michelle teaching Sam, for example, to wait her turn for the iPad. Usually when we're teaching waiting skills, we start maybe with 1 minute and then slowly increase it. Using a reward or token system as well, a token economy like this one, like a token board. I'm working for the computer, and then they have to complete 3 tasks or 5 tasks or 10 tasks before getting access to what the item is that they want. Again, using first then statements, like for example, first eat your peas, then you can have ice cream. And then provide access to tangibles, but limited and predetermined time. So when the student requests access by using a desired replacement behavior. So for example, You can have the iPad, but for only 10 minutes, and then set a timer for 10 minutes. Okay, so moving on to access to attention. So this is one thing, access to social interactions or another person's attention. So for example, it's a science lesson, the teacher is helping another student and Ethan shouts fart loudly and everyone laughs. The teacher then approaches Ethan to reprimand him and has a discussion about why his behavior is inappropriate. Then the next day, Ethan shouts fart again when his teacher is talking to another teacher. So in this scenario, Ethan wanted his teacher's attention, so he shouted fart, and his teacher came over and talked to him, and he got even though it wasn't in an appropriate manner, he still got the teacher's attention. So some of the strategies we use to respond to attention-based behaviors are using non-contingent reinforcement. So this is providing attention on a fixed schedule. So for example, okay, every 2 minutes, I will look up at Ethan and I will tell him what a great job he's doing. Good job, Ethan, you're sitting so nicely. So this is like on a set schedule. Before Ethan even has the chance to engage in inappropriate behaviors, I'm gonna give him attention. And then providing social skills training and providing attention for appropriate behaviors. So catch good behaviors. Again, so if I see that Ethan or a student is writing his tasks, wow, Ethan, good job writing. If they're walking nicely, wow, Ethan, good job walking so nicely. Or if they're coming to go and give them all the attention when they're engaging in appropriate behaviors. And then again, we're always teaching functional communication. So to ask for attention, so excuse me, look at me, raising the hand and waiting, and then again, waiting for the attention. Sometimes we're busy, we're on the phone. If we're parents or teachers, a teacher has to help one student first, and then you can give attention to other students. So making sure we're also teaching those skills. And then completely ignore and withhold attention when a student is engaging in inappropriate behavior. So this is something, it's quite difficult, I know, to just completely ignore inappropriate behaviors. Of course, if the student is not being safe, we have to intervene. But for any lower behaviors, then we want to completely ignore them, pretend they're not happening. And then when the student is engaging in those appropriate behaviors, that's when we will provide the attention. And then it's important to note with attention, any attention can be good. So a reprimand saying, stop, don't do that, can be what the student wants. So we just want to be careful with those behaviors. And then lastly, we have sensory or automatic reinforcement. So this is when a person's movements and actions feel good to that individual. So this is the hardest part of the hardest function of behavior to intervene, because it's within the person's own body. And we can, all of us, every day, we engage in the sensory behaviors like flicking the pen or moving your hands when talking. I mean, I do it all the time as well. So this is the most difficult function to intervene on. So in this example, it's a mental math test. Laura finds the test easy and she completes it quickly. She has to wait for everyone else to finish, so she starts clicking her pen rapidly. The noise is distracting her peers, so her teacher tells her to stop. So she starts tapping her nails on the desk. This is also distracting other students. So for Laura, she's feeling bored. She feels she's done with her test. She doesn't have anything else to do, so she starts fidgeting, clicking nails, and this is all distracting. So with sensory seeking behaviors, we always want to find other kinds of activities or other behaviors to replace that, rather than stop the behavior from happening, because it's within your own body, it's what's making you feel good. So especially with kids with ASD, they engage in a lot of sensory seeking behaviors, and sometimes we have to check when do we want to stop and intervene, and when we can let the behavior happen. So for us, a lot of our students, if it's not disturbing the classroom, and if it's not disturbing the student's own learning environment, or we don't usually intervene, but we will intervene when those sensory seeking behaviors are stopping the student from learning or disturbing the learning environment as well. So some of the things we use is to provide frequent opportunities for movement. So we have a lot of movement breaks, playing outside, jumping on the trampoline, and then having spaces in the classroom where students can engage in the sensory related behavior. So having a designated corner or time when students can have those sensory needs met, and then keeping the student engaged and busy. So for the previous example, we could have maybe giving her a coloring sheet or another worksheet to complete, and making sure students are always busy. And then provide fidget toys so the student can hold and manipulate. I know Rabab, our OT, she will have more tips about how to meet sensory needs for kids. Yes, so those are all the functions. And now I think Teju will talk about how we apply it in schools.
Thank you so much, Daniela. We certainly recognise many of those students that you described, and I think that that was really helpful to understand how to look at it from an ABA perspective. So I just want to delve a little bit deeper into that, and I have a few questions that I'd like us to go through together. So when we think about how we can apply ABA in schools, and I'd love if you could click through for me, Daniela, so we can have a little look at some of the points that we had actually talked about earlier. So as a head of inclusion and now the head of the Bridge Centre, you know, I've seen many benefits to having ABA included within a school, and particularly when you're working with an experienced BCBA and you have somebody that can really guide you through those tricky situations. The methodologies and strategies can really be applied to all teaching methods and across contexts. So it's not just within your one-to-one sessions like you've described, it's within the classroom. It's really looking at why those behaviors are happening and responding. And of course, having an analyst, having a BCBA that could actually go into the classroom, do those observations and give you that feedback, write those behavior reduction plans. That is an invaluable tool that, again, I felt to be the case. And I know colleagues surely will feel the same when they have challenging behavior in class. One-to-one ABA sessions, of course, can increase skills. Even those students that have difficulties with the fine motor and the academics, you know, I know ABA is able to increase the whole range of skills, because we consider behavior to be any action and not just a negative action. And of course, students can have RBTs as their LSAs, as their individual support assistants, which again can be particularly beneficial when you have a student that has more complex challenges or barriers. And Daniela, if you can speak a little bit about how we use ABA in the Bridge program, that would be wonderful.
Yeah, so in the Bridge, we have like a classroom set up for all our students, and we follow similar structure for the classroom, but then we have one-to-one RBT. So those are registered behavior technicians who have some experience, who are experienced using ABA techniques within the classroom. And then we have group instruction, and then we still conduct all our ABA, like reinforcement and all ABA techniques during classroom structures. And then we also provide this help when our students go to the mainstream classroom, and then provide support for other students who are in the mainstream, or teachers who may have students who are engaging in some of this more challenging behaviors, and giving them as well tips about how they can support that student in that classroom as well.
Yeah, and as we tend to set up classrooms to support students with communication and interaction difficulties such as autism, ABA is quite a foundational part of our program, you know, throughout everything we do. So it really is beneficial to have that in place. And of course, meeting the, you know, research shows that ABA is able to show the best outcomes for early intervention for students with autism as well, which is what we endeavour to do. So who then, Daniela, can schools go to for ABA support?
So as for the BCBA, so we have different ABA providers. So we have the registered behavior technicians who are RBTs. They're usually bachelor's level RBTs. They're given a 40-hour training on ABA concepts, and then they have to pass a competency assessment, which involves, actually using those concepts in the actual real setting, and then they have to pass an exam. So they're they're certified by the Behavior Analysis Board, and they provide they're usually the ones providing direct therapy, so they're the ones spending one-to-one sessions with the students. And then from them, we have a BCBA, so that's a board certified behavior analyst. So BCBA has either a master's or has completed the core sequence in ABA, and then has passed the BCBA exam, and it's also certified by the BACB board. And a BCBA usually comes in and conducts the assessment parts, and then assesses, and then makes goals and targets for the RBT to implement with the student. And then we also do behavior intervention plans. We provide observations, and then assess the challenging behaviors and do all the functions of behavior, and conduct functional analysis assessments if needed to conduct those behavior intervention plans. And then we have a BCABA, which is similar to a BCBA. So it's a board certified assistant behavior analyst. So they're not a BCBA, but they conduct similar role of a BCBA, but they have to have the supervision of a BCBA. So it's like an assistant BCBA. And then a BCBAD is someone who's completing a PDH program in ABA, and then they're usually they work more in the academics fields, conducting research and training other BCBAs as well.
Fantastic. So any of these people can support with ABA in schools?
Yeah, usually a BCBA is someone that you will call in for a school, or if you have a student that requires extra support in the classroom, it would be an RBT that comes in with the supervision.
And my next question then would be regarding, licensure and regulations of these particular professionals. What should schools know?
Yeah, so for so our RBTs, BCBAs, BCABAs, BCBADs are all certified by the Behavior Analyst Board, and all of us, we must follow their strict guidelines, ethical codes, supervision requirements, and I mean they do audits, not often, but they still do them as well. So, we have to follow all the rules and regulations. And so RBTs has a specific supervision requirement. So if an RBT is working as a RBT in a school, and they should be supervised by a BCBA. And a BCABA, a behavior assistant, should also be supervised by a BCBA. So an RBT shouldn't be without the supervision of a BCBA.
Yeah. So I know that there's quite a lot of quite strict guidelines to ensure that the delivery of ABA is ethical and effective. So, just a reminder to schools to ensure that if they do hire or work with ABA therapists, they do meet all of these criteria.
Yeah, as well as and the BCBA should be active BCBAs with the board. And on the BACB website, you'll be able to find a list. If you just click on Dubai or UAE, you'll be able to find a list of all active BCBAs in Dubai. And then we recently, they started the Association of Behavior Analysis in the UAE. So they're starting to apply for licensure, like DHA or CDA licensure in the UAE, but it's a long process, so that's just in the works at the moment. So
one to look out for.
Yeah.
Okay, wonderful. Okay, and my last question, you did speak briefly about this, but how can we then use ABA in an alternative pathway program?
Yeah, so ABA has a really great capacity to meet the needs of all students. Like I said, we consider everything behavior. So really you can apply ABA to everything you do in your life, even if you want to go to the gym more often or anything like that. So We want to, so it has a wide range of capacity to meet students with difficult communication. So we work on communication skills and social interactions, as well as if a student is having, we need to work on just the social skills for them to integrate better with their classmates, or even self-care skills like showering, brushing teeth, hand washing. And then ABA research upholds the value of ABA intervention. So we have a lot of research and in early intervention, early childhood, and ABA work, it's an evidence-based practice. So all the concepts and all the research and all the interventions we implement are all evidence-based. And then we have ABA trained and licensed staff that we can modify the learning experiences which target individual skills and challenges. So like Teju said, we can work on specific skills like fine motor skills or communication skills. And then at the moment, at the Bridge School program, it's based on the ABA methodology. So we have like a classroom setup with each class has 6 RBTs and a full-time BCBA.
Fantastic. Thank you so much. Thank you, Daniela. I really appreciate that. If anybody does have any questions related to the talk that Daniela's given, or if you would like to know more, please just write in the chat box. Alternatively, you can drop her an email. Okay, Daniela, thank you. We're going to hand over to Anuja now. Anuja is going to give us a talk about play therapy and social and emotional development.
Yes, thank you very much, Teju, for that, and also for the lovely introduction.
Very welcome.
I'd like to begin now. Is everybody able to see my screen? Yeah, all right.
Yeah, we can see. You can just go to slideshow on the, yeah.
Click on that. All right. Okay, so the topic for me today is increasing social and emotional skills with play therapy methods. All right, and the objectives of my talk today would be talking a little bit about social and emotional learning, the stages of emotional development, what play therapy means, the process of play therapy, and how we can apply psychology to SEND provision within school setups. All right, so this is just an image that I have taken from the internet, and it explains what social and emotional learning really consists of. So oftentimes we use the term social and emotional learning, but if we actually delve into what it means, and if we break it down into smaller fragments, we will see that it actually involves a lot of different concepts, and these concepts have been heavily research evidenced, and there have been a lot of psychologists, developmental psychologists, as well as behavioral psychologists that have coined these terms, and these terms have a lot of meaning attached to it, and we can actually see these concepts emerging and developing through different ages within students, right from 6 months onwards until their adolescence, and some of these skills are even then translated into adulthood. So I would take it one by one. First, I would like to talk about what self-management means. So self-management means managing emotions and behaviors to achieve one's goals. So we've seen that self-management can be applied to a lot of our daily life situations that involve different emotions. So for example, if a child is frustrated, if a child is getting angry, if a child is not able to understand what's happening in their external environment. So by having the right tools on how to manage yourself, and in teaching children how to develop self-management skills and giving them the right tools and strategies on how to manage different emotions, we can actually give them a lot of self-management techniques. And all of these areas that I talk about have different strategies attached to them in terms of social and emotional learning, or social and emotional learning tools that psychologists work with in terms of equipping the children in having self-management, for example. Again, if we talk about a different area, which is self-awareness. Now, by self-awareness, I mean recognizing one's emotions and values, as well as one's strengths and challenges. So self-awareness comes with identifying and recognizing the feelings and emotions that one is feeling in the given moment. So with children, we oftentimes have to teach them. We have to give them the emotional toolkit. We have to give them the emotional vocabulary to be able to articulate how they're feeling within their body. And there are a lot of ways in which we can do that. Some of the ways I will be discussing today, and there are some other ways that obviously during a later stage we can talk about. So that is with regards to self-awareness of one's own emotions and values. Then comes social awareness. So that's the complete opposite of self-awareness. Social awareness talks about showing understanding and empathy for others' emotions, towards others' feelings, towards others, towards others' social setup. So for example, we often see children who don't have this concept. So they can understand how they are feeling, but they're not able to understand how their actions or how their behavior can also impact somebody else. And that's when they engage in a lot of, fighting situation, for example, or they're unable to develop skills such as sharing, turn taking, or waiting. And those are all skills that come from social awareness. Only when the child is able to understand how their friend is feeling or how their peer is feeling, will they then have the required skills to then understand how in this situation my behavior is impacting my friend, and how my behavior is impacting my friend's feelings or emotions, and then they will be able to empathize with the other person. So this aspect is also very important in developing social skills or developing a social awareness towards others' emotions and feelings. Then the next aspect is relationship skills. Again, something that is very important for us to form positive relationships, right from the first caregivers, which is often the mom and dad or siblings or grandparents. And then it goes on to forming relationships at school with your teachers, with creating friendships, and then also with different kinds of relationships, which is, having your cousins or having your extended family relationships or having family friends. So relationship building is also something that comes under social and emotional learning. And that then translates into adulthood, where we work in teams, we deal effectively with conflict, we deal effectively with a lot of situations that crop up in our daily lives. And the same happens with children as well. When children are exposed in a classroom environment, when they're having to deal with a friend, when they're having to deal with a friend whom they do not like, for example. So, that's also sometimes which gives rise to bullying. So if the child is not able to build the right relationships, or they don't understand conflict management, or they don't understand self-management, that can also give rise to a lot of negative behaviors, or a lot of negative relationships being formed, or a lot of unhealthy behaviors that can be formed as well. Then the last aspect is responsible decision making. This comes later, at a later stage for a lot of children. So because the brain develops accordingly. So when that part of your brain develops, where you're able to take responsible decisions, when you're able to make choices, when you understand between right and wrong, when you're able to make ethical choices, constructive choices as well about personal and social behaviors, that's when responsible decision making comes into place. So a lot of times I see adolescents or teenagers, this area is very important in their development. And this is an area where sometimes they might need support from adults or professionals, where they might need to be supported and guided in making responsible decisions. If they're not making the responsible decisions, that might create a conflict in their daily life, or they might find it difficult to have positive relationships around them, or to just navigate through their teenage life, for example. So there was just in a nutshell of what exactly social and emotional learning consists of. Now I would move on to the social and emotional stages of development. So you can see that it starts from number 1, and it says regulation and shared attention. So this is in terms of, how when a child is born and when you have an infant, and then the infant turns into a toddler and then into a preschool age, and then they go into they get into the schooling age, and how they go navigate from preschool to junior school to secondary school and then into adulthood. So you can see how this progresses. So first we have the focus lies on regulation and shared attention. Then it moves on into engagement and relatedness, when they move on from just their familiar adults or familiar figures from parents and siblings. They get exposed into, their teachers, their friends, and people they see at school. And how it moves on into a two-way purposeful communication. This is where the social aspect comes into place. So, they have a lot of communication, they have interactions of different natures with people they see at school, with their friends. They engage in a different sort of a communication with their peers, and they engage in a different sort of an interaction communication with someone who's older to them or an authority figure. So they're able to differentiate then between a two-way purposeful communication. Then comes the social problem-solving skills. So in the event of them being faced with a conflict or a problem, they might have to be either supported, or if they're developing with the right skill set, they can problem solve by themselves. Then that moves on into more of a creative and meaningful use of ideas. So that here is the stage when you have your higher order cognitive thinking skills that develop, and you have more complex ideas that are making more sense for the children. You have your abstract reasoning, you have your logical reasoning, so you're able to make sense out of abstract concepts as well, and you're able to have meaningful usage of your ideas. That happen in stage 5. And then the stage 6 is building logical bridges. So like I was talking about the abstract concepts of something that you might not be able to see or touch, like, more intense themes about, let's say, the purpose of life, or, having good or bad behavior, or even if, the concepts of a sudden death, or, what happens when someone is going through a stressful time, or these kind of ideas emerge. And that's when, children are able to build logical bridges around that. Here, it's just giving you social and emotional development by age. So there have been a lot of questions around, what is it that we can see in the first year of age that can help us understand where my child is with social and emotional learning. So I've just marked with a star a few things that are of relevance for us when we talk about social and emotional learning today. So for example, in your first year, if you have a child of between the ages of 0 to 3 months, what will you see? So for example, just something as simple as making eye contact and looking at people and having a social smile, that is giving you an indication that the child is developing socially and emotionally. Now, what will you see in a 4 to 6 months child? You will see that they're able to respond to others and copy some of the movements and facial expressions of their primary caregivers. So again, that is an indicator that the child is maturing emotionally and socially, and is able to copy some of the movements and facial expressions of their caregivers. So, every time you look at the baby and smile, the baby will smile back at you. So that is one of the indicators. By 7 to 9 months, we see that children are able to play social games such as peekaboo. They're becoming more clingy sometimes when leaving the caregiver. For example, they're reaching for the caregiver when being held by somebody else, so that in that moment, they're able to develop that attachment with their caregiver. So, that is something that we're able to see in their outward behavior. By 10 to 12 months, we're able to notice that they may show some fear around unfamiliar people or objects. So they're creating that concept of familiar adults as opposed to non-familiar adults. So they're able to show fear or nervousness by either crying, or they don't want to separate from their primary caregivers by that age. Then when they come up to their 1 to 2 years, they're able to show more defiant behavior to establish independence. So you might see that your 1 to 2 year olds will show tantrums, and when they don't want to do something, or when they particularly want to get something and they're denied access, just to show their independence and defiance, they will have a tantrum. Then they also do not understand, at this age, they don't understand what others think or feel, and believe everyone thinks as they do. So for example, they get upset when they no longer are the center of attention. So this is the age where, the caregivers need to understand that children are not able to empathize with another child. So they might indulge into some behavior of snatching the object from another child, or grabbing, without understanding that, I'm hurting somebody else, or I'm taking away somebody else's toy, and that makes the other child unhappy or sad. So here is, when we as adults need to step in and need to give them a lot of communication and vocabulary, and while being in a social setup, need to make them understand that if you can feel upset if I take away your toy, so can your friend or your sibling. Now, when we come to 2 to 3 years of age, we see that they show an increasing variety of emotions. So by this age, they're able to show, happiness, sadness, disgust, fear, surprise, all of these different variety of emotions. They get upset when there are major changes in their routine, and they're able to outwardly express it as well. So they may cry, they may show upset by not being as compliant as they usually are if there are any changes to their routine. By 3 to 4 years, we see that they start becoming more cooperative in terms of their play time. They're able to share toys, they're able to wait for their turn. So this is when their brain is developing a little bit more, and they're able to understand concepts which not only involves themselves, but they also involve the perspective of another person. So they also sometimes work out conflicts with another child. They're able to take turns in small groups. Excuse me. They're also able to use words to communicate their needs instead of just screaming and throwing a tantrum, grabbing or whining. They're able to reason out with an adult, or they're able to understand a logical explanation when an adult steps in and tries to navigate them through that situation. By 4 to 5 years, we see that children are able to understand somebody else's emotions quite well. They're sensitive to others' feelings. They're able to verbalize how the other person is feeling. So if you tell them a social story and you ask them, how is this person feeling in this situation, they're able to articulate. They have a vast variety of vocabulary. They have more words in their repertoire. So, they're able to understand much better on how the other person is feeling. They're able to also understand the difference between real life and make-believe. So by 4 to 5 years, the children are able to understand that this is only pretend play. And a lot of times you'll hear the children of 4 to 5 years saying that this is fake, or this is not real life, this is just pretend play. So they're able to understand and differentiate between real life and pretend play as well. Now I would like to talk a little bit about play therapy. Sorry, just moving too quickly. Sorry, I had this slide on before, so I'll just go through this slide on what is play therapy. So by play therapy, we mean it's a technique, it's a research-based technique whereby a child's natural means of expression, which is play, is used as a therapeutic tool or as a therapeutic method to assist him or her to cope with emotional stress or trauma. So a lot of times we see children who have emotional disturbances because of how their life has been. So sometimes we see children who have gone through a loss, or who have seen death, or who have seen a lot of changes in their life, and who are going through a lot of emotional distress or trauma. And here is when we use the play therapy technique as a means to be able to express or channelize their emotions and feelings. And I will be talking a little bit more about this in my consequent slides. Now, who is this most appropriate for? So children between the ages of 3 to 11 are most suited for play therapy, as it provides a way for them to express their feelings and experiences using different means of play. So different means of play could be using toys, I will be going through a play therapy toolkit with you as well, just to make you understand what are the means that we use in play therapy sessions. And why do we use play therapy? Because it's a natural way of a child's expression. So it is very intrinsically motivating and pleasurable for a child, because what could be a better way than using just play methods for a child to be able to express his or her emotions. So if we go through the toolkit of play therapy, we can see that in this we use a variety of different techniques or tools for the child to be able to expose to different ways in which they can channelize their emotions or express their emotions. So there is drama play, so we expose them to a lot of puppets or masks or figurines or dolls, where they can actually express or use play as a method of expressing their emotions, or expressing their emotions onto a doll. For example, children sometimes say that, okay, this is me and this is my friend, or these are my family members, and then that's how they use different roles. They also use sand trays, or we can use art forms. We can use different ways of art forms. So for example, we expose them to a lot of paints and drawings and crayons. So even in the picture, you can see that, sometimes children draw different scenarios, and then they interpret it in their own way, and they will tell you a story that they see is happening. Another thing is dance and movement. So a lot of dance and movement also allows them to channelize how they're feeling in that particular moment, and how different ways of dancing and movement then allows them to express their emotions. Also, clay, using Play-Doh or clay just to use their sensory input also helps them. A lot of therapeutic storytelling or creative visualization through the use of, again, dolls and puppets is also a way in which children are able to express themselves. Now, what are the goals of play therapy? Play therapy really helps children to boost their self-acceptance, because sometimes we also see that children have different issues around accepting themselves, because somebody has made a remark about their body image, or somebody has made a remark about how they are or how they look. So in this way, they're able to really express themselves and channelize different emotions that they might be feeling. It helps with their self-confidence, self-reliance, on how you are in control of yourself, you are in control of how you exhibit your feelings and emotions. Again, a lot of talk about exploring their feelings and expressing their feelings. This also gives them a lot of opportunities to practice control and responsibility, because in that particular session, the child feels in control of himself or herself. And it's mostly child-led. So whatever it is that they want to choose, and however it is that they want to express themselves, so they have a lot of opportunities to arrange different types of control and responsibility within the session. They also explore alternative views of their problems and relationships. It increases their feelings, vocabulary, and emotional concepts. They're also able to learn and practice problem solving and relationship building skills. Now, there are some powers of play, as we call it. So this is just an extension of the previous slide. So what can play therapy sessions do is that it facilitates communication, it fosters emotional wellness, it enhances social relationships, and it also increases personal strengths. So, there's a lot of resiliency that is built. There is a lot of moral development. There's also a lot of self-regulation and social competence. So there are lots of different areas that we can build on when we work in a session during play therapy. Now, just to give you a little bit about how we work on that and how this is correlated with research and how this is heavily evidence-based. So this is just a play therapy dimension model that we use when we're actually using the play therapy sessions. And it was developed by someone named Laurie Yesenik and Ken Gardner. And they use this method and they have coined the term as well. And there was also expounded by Charles Schaffer. So this is one of the dimensional methods that we use. Now, if you look at the image, you can see that there are two things along the x-axis and y-axis. One says, so if we look at the x-axis, we can see on one end we have non-directive, and on the other end we have directive. And along the y-axis, we have consciousness and unconsciousness. So these are the two axes, the two different axes that we work on. And then you can see that there are 4 quadrants. First one says active utilization, open discussion and exploration, non-intrusive and responding, and co-facilitation. So you can do a little bit of research and extensive reading if you want at your own time to understand what these quadrants mean and understand what the different axes mean. With regards to giving you just a little bit of a brief overview, by directive and non-directive, we mean from a therapist perspective. So the therapist role is also very important. So sometimes it's more directive with regards to what the session looks like, how much of a direction you would give to the child, how much freedom and how much responsibility you would give or assign to the child in a particular session. So when it's more directive, we would have the session as more structured. We would let the child choose from a particular choice board, for example. We would give him or her a few options, and then we would the child would have to choose from those particular options to play with in the particular session. And there's also non-directive. So non-directive is something that is completely child-led. So the moment the child enters the play therapy room, they're exposed to a lot of different toys and things around them, and they can choose on what they want to play with, or they can choose on how they want to express themselves. And the therapist's role is very minimal. And normally we begin the sessions by being more non-directive, where the child can freely express themselves. And later on, we go towards more directive, and the therapist takes on a more powerful role where they're able to control the environment. Okay, now this is just a graph that shows us the different stages of play therapy. And towards the end, you can see that I have put these 5 words in a box. So those are the 5 R's that we use when we explain the stages of play therapy. And they're called as relationship, release, recreation, re-experiencing, and resolving. And these all happen during the different stages of when we go through the play therapy stages. So I will just take you through these very briefly, and we can see that we begin with point A, and then we move on to point B. So we can see that in point A, we're talking more about the exploratory stage. So that is where the child develops or builds a relationship with their therapist. Then we move on to the point B, which is testing for protection. So here is when we have, the child is able to establish trust. The child is able to then understand, how much of my feelings and emotions am I able to then share with my therapist. So this is really important, because this is the stage where the child is able to understand, the child is able to basically understand the level of trust that they can really have with the therapist. So relationship is built, and the child is, established trust. They're able to release a lot of emotions. Then comes the dependency stage, where the child is actually able to recreate or re-experience some of the traumatic experiences that the child is going through. And this is where the child is actually able to relive some of the traumatic experiences or some of the difficult emotions that the child must have experienced in the past, which is then creating a lot of distresses for him or her creating a lot of distress for the child in that moment. Then comes the resolution stage, which is also called as the termination stage. And during this time, the child is able to have, a lot of, the child has had a lot of opportunities to release unhealthy emotions or to recreate emotions where, they have felt a certain way. And by recreating and re-experiencing, they have been able to then release all of those negative emotions. And then the therapist also is using the directive approach to replace those negative emotions with more positive terminology, by equipping the child with a lot of positive emotions, because we see that the child in that moment is so stuck in the negative feelings and the negative emotions that they find it very difficult to overcome and, actually change their perspective. So through the usage of play methods and through the usage of different communication strategies that the therapist is then able to give the child, they're able to use a lot of healthier ways of communication. And then towards the end, we have the termination stage, where we're able to see that the child has overcome the emotional distress and is now ready to be, the session is now ready to be terminated and the therapy process ends.
Thank you so much, Anuja. I really appreciate all of that information you've shared with us. And I myself have seen the benefits of play therapy. And as you stated, that what a wonderful way for children to be able to explore their feelings through play. Yes, it was really nice to understand the developmental stages of that particular strategy. Now, as I know that we are very pushed for time, and by pushed for time, I mean we've already run over, I'm going to just be very brief. I'm actually just going to hand over to you, Rabab. But first, I'd just like to highlight how psychology is helping schools bridge the gap. Psychologists like Anuja and many others across Dubai are able to go into schools, offer in-class observations and feedback, of course, conduct developmental and clinical assessments when we want some more answers, whether they are diagnoses or just outlining the profile of the child in more detail. Anuja is our clinical supervisor at the Bridge, and she's an absolutely instrumental part of ensuring the program is triangulated, and that means the OT, the speech, the ABA therapy, and all of the rest of it is working in collaboration. And without that, I think we wouldn't be able to piece those parts together and really have that effective program. And I know, Anuja, we won't mention it now, but we'll share the slides. There are some important licensing regulations as well that apply to psychology that schools should look out for. So be that a DHA license or a CDA license. And then, of course, if they're working in healthcare city, that would be the DHCC. Is that correct? Yes, you see, I've got it. Okay, awesome. Thank you so much, Anuja. I'm going to hand over to Rabab now. Rabab, would you like me to share the screen for you? Yeah, okay, I'll do that now.
Okay. So good evening, everyone. Today, I'm going to discuss about improving self-regulation along with the sensory processing strategies in the classroom. So I'll try to be really quick about this and try to cover each and everything that has been decided to do. So the objectives of the objectives are just to understand what exactly sensory processing, what is self-regulation, what are the sensory processing disorders that the child faces, and how can we support these children in the classroom along with sensory diets, tools, resources, with environmental changes and the strategies. Okay, so to begin with, what exactly is self-regulation? So self-regulation is important because it allows the children to do well in the classroom. It gives a sense of feeling good about what they can handle, and it feels good about themselves. So it involves controlling one's behavior, emotions, and thoughts in the pursuit of long-term goals. More specifically, these emotional self-regulation refers to ability to manage self-disruptive emotions and impulses. I know it's a little confusing, so we'll just break this down. So to begin with, self-regulation involves 3 components: for the sensory, emotional, and thinking skills, wherein Anuja and Daniela has covered more of emotional thinking skills. I'll be covering more of sensory part. So sensory, to begin with, what exactly is sensory processing? So sensory processing or integration, also known as sensory integration, is the effective registration of the sensory input from the environment, including one's own body. It is the way the brain receives information from the environment and how the body reacts to these informations of the environment. And children who have sensory processing disorder, they have difficulty in processing these environmental senses into the productivity of the daily living, in which, if, for example, if there is a overstimulus of light, for example, the child will not be able to regulate, and they can have like they will blink their eyes or they'll shut their eyes tight because they're not able to regulate that much of light. So these sensory, so basically we talk about 5 senses, but actually if we look closer, there are 8 sensory systems. So we will talk about these 8 sensory systems briefly. The first is the visual input. The vision is that is what we see through the eyes. And gustatory is the one that is the taste. The tactile is the touch. So the children who have difficulty in regulating with different textures, will it be soft, will it rough, or some children do not like going on the sand or on the grass. They do not prefer wearing socks or shoes, or they prefer wearing only particular type of clothes. So these are the dysregulation that happens when there is difficulty in the tactile system. Then there is auditory, in which this is something that is a part of the daily activity, but some children have difficulty in regulation of this auditory input. For example, in the classroom, if there are a few children in the classroom and one child starts crying or has a meltdown or a tantrum and starts screaming, the other children who has difficulty with auditory processing may go into a shutdown or may try to cover their ears and may not be able to regulate these high pitched sensory input. The next is smell. So that is olfactory input, in which some children who cannot discriminate between the good odor or the bad odor, which can lead into like if there is a chemical, a bottle of glue or a bottle of paint which has very stringent smell or something, and they're not able to regulate if it's a good smell or a bad smell, they might drink it, which can cause harm to the body. The next is, so these are the 5 basic senses. The 3 other senses, the one is the vestibular, that is balance and coordination. So in which the child is unable to regulate between on an unstable surface, or they seek a lot of movements like swing or going on the balance board. So that is what the body requirement is. Then there is proprioception, that is the joint position sense. Like for example, if I flap my hands, so my body would not realize that this is my, I'm so sorry, that this is my hand, and I'm unable to regulate that pressure. So a lot of children who have these sensory input of flapping of hands, they have difficulties with body awareness and joint. They have less body awareness and joint compression issues. And the last one is interoceptive or interception, in which this is something called as the hidden sense. The interoception is basically the awareness of own self, like if I'm hungry or thirsty, or if I'm sleepy, I'm unable to communicate about the same, which can also cause into self-regulation, disruption in the self-regulation. So going ahead, we have to give these children up sensory diets. So the sensory diets include, so these are basically the 8 senses of the body, which also which can be used in day-to-day activity for improving their self-regulation. So going ahead, so what exactly self-regulation is? It is the ability to monitor and manage the energy states, emotions, thoughts, and behavior in a way that is acceptable, and it produces a positive results, such as well-being, loving relationships, also learning. And So these are, okay, so this is the calming folder. This is for managing the sensory system of the body. The calming folder includes either quiet time, in which you give them a dark tent with some lights, calming lights, where they are into the relaxation mode, or it can be given a book to read which has pictures or images. They can be given a tight pressure, tight hugs. They can be given joint compressions. The children who have different sensory issues, so like tight squeezes or jumping on the trampoline, can also be various ways in which the child can be made calm and be able to sit in the classroom better. So there are different types of sensory breaks. The next slide, please. So the sensory breaks are either calming or alerting. So a child who is very hypersensitive, who is very low lethargy, in a low mood, can be giving alerting responses. That is the opposite of what their mood is. So they're bouncing on the ball or jumping on the trampoline, or different types of jumps such as crab walk, frog jump, or just bungee jumping. And the child who is like too much into hypersensitive or with high on awareness can be given calming activities such as yoga, deep breathing, blowing. So these help them calm down. So the examples of mental break would be just reading a book, music, coloring, creativity, or hobbies. Examples of physical breaks would be dance or sports activities, or just walking or jogging around. There are spiritual breaks such as doing yoga, meditation. Then there are sensory breaks. Sensory breaks are always altered according to the need of the child. So if the child is happy with the textures around, they can be given more of textures. If the child is happy with different types of like hugs or joint compression, they should be given that. If the child likes more of if the child likes more, I'm so sorry. Okay, I'm so sorry. If the child likes more of, okay, playing on the playground or something, they can be subjected to that. So, and they can be given positivity or self-talks like affirmations that can also help. Social support which is done in the groups, or group play wherein they can see each other and play together with the help of a peer or parent or a friend. And these should be given as immediate feedback into positive or negative reinforcements that has already been spoken about before. So these are the examples of different things that can be used for as a sensory play. So these are basically fidget toys or chewy tubes. These are pop tubes, or these are all used for sensory breaks. And the children who do a lot of mouthing or they are seeking out for textures, these things can be given for the children around. And so going ahead, let us go to the zones of regulation. So this basically, what is the importance of zones of regulation is to support the development of the self-regulation in children. So all the different ways of children feel, the way they feel, the state of the alertness, the experience, they're basically categorized into the 4 colored zones. And these zones provide a common language and compassionate framework to such positive mental health and skill development. So by serving as an inclusion strategy for neurodiverse learners, those who have experienced trauma, who also have specific needs in terms of social, emotional, or behavioral development. So for example, if the child is in the red zone, so it means the child is very angry. It is necessary to talk out to the child, or they can be given some calming activities where they can come, like relax themselves out and come out of that zone. So it depends upon what zones they really are. And if the child is verbal, you can ask them what zone they are in by showing the picture, and they can definitely tell you what they're feeling about. And that is how we work on the emotional development of these children. So going ahead, the classroom strategies. So Also in the classroom, there are movement breaks, there are dark rooms, there are corner rooms, there are seats. You can give them wobbly seats for children who are seeking a lot of movement. It is necessary to give them a wobbly seat or an imbalanced seat for them to regulate themselves in the classroom while sitting activity. And also, if in the classroom, in the group you can do yoga, or you can do movement activities or songs wherein they can channelize their need for movement. Then they can do fine motor skills together, they can do handwriting worksheets together, copying from the board. This is all important. These are strategies that can be done in the classroom. So yes. So next, so how can we apply OT in school? So this is basically, OT can be done either in group sessions or one-on-one sessions. So in group, it is basically just improving their turn skill, taking skills, improving their motor planning, improving their sensory play, improving their like giving them sensory diets. Because if you start the day with a movement-based activity, going ahead, they can have better sitting tolerance throughout the day, and they can show better skills when they're doing any fine motor or tabletop or handwriting task. And one-on-one is very specific to target specific behaviors, such as if they have difficulty with gross motor, fine motor, sensory. So this is what we do in one-on-one sessions. Yes, thank you so much. This is what I had to cover everything in the session.
Okay, thank you so much, Rabab. I really appreciate that. And I know that you speeded through a little bit. And if anybody does want to have some more information, Rabab would be happy to answer questions. We'll share the slides which has her email address on. But before you do go, Rabab, if you could just tell everybody who can help with these sensory difficulties and physical difficulties in school.
Yes, so basically, and along with the occupational therapists, there are developmental pediatricians, there is physiotherapists. Physiotherapists can help with the help of like children who have developmental issues, along with the sensory issues or learning issues. Children who specifically have development issues, physical therapists can help with that. There are special educators who can help with learning and remedial education. And of course, psychologists and ABA therapists, along with the occupational therapists, can help in the classroom setting.
Exactly, and I know that we've found it so very useful to have you with us, starting the day with physical activity each day, and also those personalized sensory diets which students have. And much like ABA and psychology, of course, we have to look out for the regulating bodies, and that would be DHA and the government of Dubai for occupational therapy. And with regards to an alternative pathway, OT is definitely an invaluable part of a multidisciplinary team. We really promote multidisciplinary teams at the Bridge. We believe that there is equal value in every discipline, but they work together hand in hand. So when we have OT there to work on the sensory and work on the movement, and then we've got our ABA with tackling behavior and increasing skills, and of course that psychology, that developmental overview, we really can see that our children are able to progress. And I know that, again, there are multiple OTs and physiotherapists across Dubai that would be able to support schools in their journey. So I am going to round up now. If you do have any questions for Rabab, like I mentioned, you can drop her a mail or you can write in the chat box. Before we go, I just want to share with you that the Bridge Learning Centre has partnered with a brand new website for hiring special educational needs staff, thesenko.com, and it is launching in July. And as a head of inclusion, I know the struggle it is to find good LSAs and therapists. And this is going to be a place where you'll be able to look all in one go, filter by experience, by license, even by their vaccination status. And all of the BSME teachers and also inclusion leads that have attended or will watch this recording will be able to access that site for 3 months for free. So you'll get more information closer to the time of launch. But for now, I will say goodbye. And I really, really appreciate all of you who've joined us or who have watched. the recording. So thank you so much. Thank you, Suffolk British School, for inviting us to do this talk as well. Much appreciated. Okay, thank you. Bye now.